Welcome to Chiropractic Roots, the official podcast of the Kansas Chiropractic Association. Here, we explore the stories, struggles, and successes of chiropractors across the Sunflower State. In each episode, we interview Kansas DCs to learn how their chiropractic journey began, how their practices took shape, and what lessons they've learned along the way. Whether you're a seasoned professional, a student, or simply chiropractic curious, you're in the right place to hear from the roots of the profession. I'm Dr. Travis Aller, Executive Director of the Kansas Chiropractic Association, the nation's first chiropractic association. Let's get adjusted. Our guest today is Dr. Mark Balderston. Dr. Balderston, welcome to Chiropractic Roots. Please tell us a little bit about yourself.
Well, I'm from Mission, Kansas. Attended Shawnee Mission North. I attended Johnson County Community College, then Phillips University. Then I got into chiropractic college at Cleveland and Kansas City at 38th and Troost. So that's been my career. I got out chiropractic college. I got out in 1978. So I've been around for a while.
Just a little bit, almost as long as
Yeah,
you've been alive. Um,
yeah.
so, why did you choose to become a chiropractor?
Well, I was working at the Amos Funeral Home in Shawnee, and there was a chiropractor next to the funeral home, Dr. Fry, Dr. Clyde Fry, they called him Dink, and we struck up a relationship. And then I met his daughter. And so then she and I started dating. And when I asked him if I could marry his daughter, he goes, "How are you going to support her?" I said, "Well, I want to be a teacher and a coach." He goes, "No, you don't." I said, "Well, you got something better?" And he goes, "Yes." So that's how I got into chiropractic, through asking my future father-in-law if I could marry his daughter.
It's interesting. So, was that
Yeah.
your first exposure to chiropractic?
No, when I was in seventh or eighth grade, I was at Old Mission Junior High one day. All of a sudden, my ear was starting to touch my shoulder, and I couldn't move it. So my dad said, "All right, we're going to the chiropractor." I'm going, "What's that?" And so he took me to Dr. Rhodes down in Mission, and he did all his exam, and he treated me. And as I still remember, I'm sitting on the treatment table, and my dad's there. He opens his desk drawer, pulls out an old cigar box, and open it up to my dad and says, $5. So that's how much my first treatment. That's my first exposure to chiropractic. And then through high school and sports, in college, I saw a chiropractor a few times.
Yeah, the prices have changed a little bit since then, haven't they?
A little bit, yeah.
So, how did you pay for chiropractic college? And do you know how much you paid?
Well, when I first started chiropractic college, it was like I believe $85 a month. Then the last year they raised the tuition to, I think, $125 a month. And when I started Cleveland, I was going to school at night, again at 38th and Troost. I think classes were around from 5 o'clock till 10:30 at night, somewhere around there. And I was working at the Amos Funeral Home anywhere around 60 hours a week. Well, I did that for about 9 months, and I turned into a zombie. So I switched to day classes, and I dropped my hours of work down around 40 hours a week. And students, when I tell that story to them now, they go, "How did you do that?" I said, "I didn't have a choice. I had to survive. I had to eat." So I worked and went to college, and my wife worked, and we got through it.
So I assume that you didn't have any debt from college at graduation.
It was about $1,000. I think I borrowed it from a cousin and paid it back very quickly. But I was fortunate at the time we went that the tuition is not what it is now.
Tell me a little bit about your first practice, where you went to practice after graduation.
Oh, when I first got out of school, I went practice in Enid, Oklahoma. And I was playing baseball at Phillips University in college, and I injured myself. I saw a chiropractor there, and then he knew I was going to go to chiropractic college, so he said, "Hey, when you get out, contact me and see if we can make some type of arrangement." So I did, moved down there, and I was there 4 weeks, and it was not a good situation. He was seeing a lot of people a day, but the way he treated staff and just various things, it just wasn't good. So I told my wife, so I said, look, if I pass that final part of the national boards, we're heading back home, back to Kansas City. So I started out in Enid, Oklahoma. Then I opened a practice in Mission all by myself in a round medical building. And that's where I started. I didn't have any, well, my wife worked with me for a while, but that's where I started in my second practice in Mission.
And is that where you're at now?
No, I've moved, I think I counted up 7 times,
Wow.
but still in the Shawnee area. Yeah.
Okay. So how did you market yourself when you first opened up?
I'd played a lot of softball. I was like playing 5, 6 nights a week. I met a lot of people that way, and a lot of my practice came from that. Played a lot of golf. A lot of my golf buddies became patients. I joined like the Optimist clubs and various civic organizations, and that's how I got my name out there. I was one of the team doctors for Shawnee Mission North athletics. I was on the football field for like 35 years. And so that's how I got my name out there and marketed myself.
Did you do any paid marketing?
If I did, it was very little.
Hmm.
Yeah.
Okay. So did you have a mentor early in your career?
Well, my father-in-law, Dr. Fry, he would have been a mentor. And then there's some other older doctors that helped me out if I had questions and concerns. One of my biggest mentors was probably Jim Edwards, who was from Emporia. Him and Glenn Hazy, they were great mentors. If I had questions, concerns, they would help me out quite a bit. So, I had a few that helped me out quite a bit.
Okay. So where do you practice now?
I'm in Shawnee. I'm at the Midland and 435. I recently sold my office space to a dentist that was wanting to expand, and I'd been at that office for 13, 14 years. So it gave me a good opportunity to sell that space. And now I'm in with Mark Swicker and Brett Lichtig at in Shawnee. They had space available, and so it worked out good for me. The great thing is I only live 2 minutes from my house. That's the great thing, and only 10 minutes from the golf course. So I feel fortunate.
You've got to have your priorities there, don't you?
Yes, I do.
So how do you like practicing in a multi-doc office versus by
It's
yourself?
good. It's good because you can bounce ideas off them. And the great thing about being here, I have no administrative responsibilities at all. And that has been a big, big help, big relief. That takes a lot of time and energy, and so that's been nice.
Do you do any marketing now?
As far as marketing, not really. Maybe to a little bit to some attorneys, but as far as, I'll do in-house with patients, a little bit of Google, our website. That's about it. Now, I don't do a lot of heavy marketing. No.
Mhm. Okay. So how do you think chiropractic has changed since you first got into practice?
Well, it's changed quite a bit in the sense that, first of all, electronic health records. When I first started, you just make, little scratches and circles and arrows. That's changed considerably, and it needed to. I just wish it wouldn't consume so much time. And then that second thing would be public recognition. Um, Back when I first started, it was a struggle being recognized as an entry level provider. Compared to my father-in-law, it was nothing. When those guys, as you well know, history, they were being thrown in jail. So I think that public recognition has changed considerably. And recognition not only in public, but also with other healthcare providers. And I think that's been real significant.
How do you approach building patient trust and retention?
Just being straight and honest with them. I have doctors come in here that shadow me or they become preceptors. And I always tell them, tell, don't sell. Just tell them what's wrong. This is what it's going to take to get you stable. But don't try to sell them on something because the patient can smell that. You're trying to sell something. You're trying to pull something over them. Just tell them, don't sell, and do good work. And if you can't help them, then be upfront and honest with them that you'll refer them to someone who can. So that's how I've always practiced.
Do you have an area where you focus most of your practice on? I know you mentioned a lot of sports. Do you focus on sports chiropractic or?
When I was younger, I did a lot of sports because, again, I was at Shawnee Mission North for like 35 years. I was on the medical team at Johnson County Community College for, I think, about 12 years out there. I still do some sports, mostly family practice, general practice, PI work, but not as much sports anymore.
Next question. I know that you do a lot of continuing education. Do you have any advanced additional degrees on top of the chiropractic degree? Any certifications?
Certified chiropractic insurance consultant. Recently, I achieved fellowship primary spine care through the University of Buffalo, New York, Jacobs School of Medicine. So I did that. So I don't have any diplomat, but I like that fellowship through a medical school, and that's helped out quite a bit.
Okay, good. Now, I also know that you serve on the Board of Healing Arts.
I do.
How did you get into that position?
Well, I was nominated by the KCA, Kansas Chiropractic Association, and they selected me, which to me it's been an honor. And I got appointed by Governor Collier. What's that been? 5, 6 years ago now. And then I was recently, you have to apply every 4 years, and I was appointed by Governor Kelly. So it's been an honor to be on the board. I've really enjoyed. I've met some really great people, and again, I enjoy serving, giving back to serve to the profession.
Where do you think or hope chiropractic will go in the future?
Well, I hope it continues to get public recognition more and integrate with the medical profession more. Again, compared to when I first started, it's considerably improved. I hope it continues there. Of course, you got the doctors in the VA, which is fantastic. And again, just the public recognition with other providers and the community, I think that's where it's going.
Good. So, is there anything that you wish you knew that you know now that you wish you knew when you first opened into practice?
Yes, when you have a question, seek advice. Don't be so naive. Ego costs a lot of money. Get help from people who have been around the block before, so you don't get beat up going around the block. And there's so many other doctors out there that help me, and they'll help younger doctors also. Don't be afraid to ask.
Yes, that is great advice. And if you need to ask, the KCA is a great place to go ask those questions. If we don't know the answer,
Right,
we definitely know someone who does know the answer and someone that
right.
can help you out. So, yeah. Um,
One thing, Dr. Aller, is I was thinking that the future of chiropractic, I think it's grown a lot because of being evidence-based. You can support what you do without any hesitation to anybody that this is what the evidence shows and this is what you do. I think it's philosophy is still important, but I think evidence-based is more important and patient-centered. So and gives credibility. So a little bit for the future of chiropractic.
yeah, good. You mentioned recently moving your practice. One of the questions that I'm asking some of the older doctors is, do you have an exit strategy for your practice?
Well, my wife says when I die, be a good exit practice. Right now, because I'm on the Healing Arts Board, you have to have an active license, and I really enjoy again the work with the Healing Arts Board. So you have to have an active life. So I could have another 6 years on the Healing Arts Board. So we'll discuss it then. When we reach that point, we'll discuss it then. But as long as I can work and get to the golf course on Tuesday and Thursday afternoons, I'm good.
Wonderful. What is something that would surprise your patients if they learned it about you?
Surprised about me that I am an extreme introvert. When you're in the office, patients wouldn't believe me, but when I when I'm out in public in certain settings, I'm an extreme introvert. And I always compare it to, now this is dating me, but Johnny Carson, the comedian on TV, he was an extreme introvert. Now on TV, you couldn't tell. But when he was in private settings, such, very uncomfortable. And I get uncomfortable in a private setting and such. But I remember early in my career, because I was such an extreme introvert, I said, you got to get over this. If you're going to eat, you better become a little bit more active. So that would be a surprise to patients.
So what did you do to get over that in practice?
Uh, well, you just start asking people about themselves. You learn about people, how to win friends and influence enemies type thing, Dale Carnegie. But those things, I had to do it, and I've done pretty good at it. But still, if there's a moment, I can revert back to being an extreme introvert. So I think that they would be surprised by that.
If you weren't a chiropractor, what do you think you would have done instead?
Well, like I told my father-in-law, future father-in-law, when I asked if I could marry his daughter, I probably would have been a coach and a teacher. And after 30 years of practicing, I got part of my wish that I became the head softball coach at Shawnee Mission Northwest High School, and I did that for 12 years while practicing also. And we won two state championships and a couple runners up, and we really had good success. But so I never taught, but I got to be the coach that I always wanted to be.
Wow, that's great. So, Dr. Balderston, thank you for joining us today on Chiropractic Roots. Before we end today, though, is there anything else you would like to add?
I'm grateful to the doctors who helped me in the past. There's been so many of them. I've had some great times. I remember the chiropractic days in college, meeting some great friends like Joe Ventura, Sid Vaught, um, Paul Shaw, the late Paul Shaw. He was a former third baseman for the Kansas City Royals, and he's part of Trivia's. Who was the third baseman before George Brett? Well, it was Paul Shaw. And we made some great friendships during college, and so I always remember that. So those were good times.
Wonderful. Again, thank you for your time today. Thanks for tuning in to Chiropractic Roots, brought to you by the Kansas Chiropractic Association. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with a fellow chiropractor or student. To learn more about the KCA and our mission to support chiropractic in Kansas, please visit kansaschiro.com. Until next time, stay grounded, stay growing, and keep adjusting.